Hello, my name is Sten Vermund. I am a pediatrician and an infectious disease epidemiologist. I serve as the dean of the Yale School of Public Health here in New Haven, Connecticut. Epidemiology is the study of disease patterns in populations. If you have an epidemic, you might want to call an epidemiologist. If you have an illness, you might want to call a doctor and a nurse. So we're dealing with a lot of issues at the community level. This gives us insights as to how we can prevent infection and how we may mitigate disease. So the epidemiology of coronavirus is that it seemed to have emerged in central China, end of November, beginning of December. It took the Chinese about a month to get their arms around this problem and to respond to it aggressively. Unfortunately, during that month, there were many people who were infected, and there were many people who left the urban megacity of Wuhan, China, and disseminated the virus to other parts of China. When the Chinese realized how severe the epidemic was, they did something that was virtually unprecedented in history, which is they shut down the entire region. First the city and then the region, asking 5 million people, 10 million people, it was even a bigger number at the end, to stay in place, not to travel, to limit their social interactions, practice something we call social distancing. And it seems to have worked. After a terrible epidemic, they just the other day had no new reported cases in China. One of the exports of this virus was to nearby South Korea, where they had a terrible outbreak, and it was concentrated in a social group around a church, and a very high attack rate in the members of the church who had a lot of social interaction. And they were a little bit secretive, and they didn't want to let people know for a while, and that didn't help things. So there was an outbreak in Korea, which became the second largest outbreak. The third largest outbreak, which became especially dramatic in late February and early March, was in Italy. And in Italy, especially northern Italy, there was a major explosive expansion of the epidemic. When public health measures were recommended, they weren't taken very seriously. Social distancing was more or less ignored for a while, and that let the virus take a foothold and expand very widely in Italy. From Italy, it has gone elsewhere in Europe. Some of that came from China, some of that came from Italy. And to make a long story short, we now have well over 120 countries in the world that have experienced the virus. So when an epidemic jumps continents, we call it a pandemic, and that's why the World Health Organization has characterized this as a global pandemic. So having 0 cases in human beings in early November to a global pandemic of millions of cases now, this is why we're taking this so very seriously. Another part that you need to know about the virus is that this is about as transmissible as the flu virus or influenza. And influenza transmits quite easily between people. If one person gets infected, on average, they'll pass it to about 2.5 more people. And that's how you get exponential growth, because it just keeps passing and passing and passing. The coronavirus seems to be equally infectious as influenza. The trouble is it's 10 times more lethal. And so our efforts in trying to control this virus is because the epidemiology tells us that it's just as infectious as influenza, it's 10 times more lethal than influenza, and that we have a number of preventive strategies that can help us substantially reduce the extent to which the virus will spread. A vaccine is not available to us at the present time. There are candidates that are being developed as we speak, but you must test these in humans for safety, and then you must find out the degree to which you generate an immune response. That will take many months, and I would say that it's unlikely that we will have a vaccine available to us in 2020. And we'll be lucky to have one in 2021.